The stab wound is very severe, and when it was recurring, I might have exercised his lower gluteus maximus, and the symptoms of the stab wound immediately improved. The logic is not that because you exercise the bottom, the pelvic floor muscles relax. No. According to this logic, the more I exercise his bottom, the more it tilts backward, and the more the pelvic floor muscles are lifted, it should actually worsen. It is because it affects the bottom, which affects the spine. Sure. When the spine is stable, the diaphragm becomes more stable. When the diaphragm is stable, it stays put. And when the diaphragm stays put, the internal organs stay put too. When the internal organs stay put, the pressure is reduced. Thus, it helps you. If you do heavy weight training like this every day, it can actually harm your pelvic floor muscles. So, in essence, any roll is like the yin and yang in Tai Chi. It will essentially rotate, sometimes being the good guy, sometimes the bad guy. There is no absolute good person. The reason someone is considered good is because the significance placed in front of you is not clear enough. Do you agree? The lower fibers of the gluteus maximus are the same. It's all the same. So, when studying medicine or sports rehabilitation, don't just see people as good or bad, and the same applies to how you conduct yourself. Don't think someone is either a good person or a bad person. Every individual has aspects worth discussing, whether what they do is right or not. Whether it's Qin Shi Huang or Genghis Khan, you need to consider if their achievements outweigh their faults. So, when studying sports rehabilitation, don't just say things like, because when I first participated in institutional training, the professors would teach that there are 4 muscles in the human body that absolutely cannot be strengthened, and I remember them well. If you think about it, you can remember it very well. They taught us that these muscles cannot be strengthened, and we labeled them. Strengthening them causes swelling. Outer hip muscles make your waist sink. Pectoralis minor makes you sharp-eyed, tongue on the ground. Why would I design it? Why should it exist in the human body? Everything born has its purpose. The following statement is, never discuss whether a movement is good or bad. Just consider when to use it, on whom, and in what situation. This way, you might understand sports rehabilitation. So to sum it up, only consider the alignment of good and evil, not right and wrong. The lower fibers of the gluteus maximus nod at the bottom. When I was a colonel, I strengthened it, and it did this. This part is the lower fibers of the gluteus maximus. When it is already looking up at the bottom, if I strengthen it further, it becomes very sinister. The same muscle, using the same movement at different times, plays different roles. All right, this is the gluteus medius and minimus. What about them? What we originally learned is that they contribute 1/32 to internal rotation, 1/32 to hip flexion, 1/32 to anterior tilt of the femur, 1/2 to posterior tilt of the femur, and allow for hip abduction while maintaining stability when the leg is supporting. However, show you the gluteus maximus. Here is the gluteus maximus marked. After removing the upper bundle of the gluteus maximus, here are the gluteus medius and minimus. The gluteus medius is on top, the minimus is underneath. In other words, the gluteus medius is more straight, vertical, and it has relatively less internal and external relationship with the iliac bone. What does it mean by relatively less internal and external relationship? If I am on the side of the iliac bone, I am almost perpendicular to the iliac bone. So, when I pull downwards, will it cause the iliac bone to grow outward? No, it won't. It will pull the iliac bone downward. So when can the iliac bone abduct? When your iliac bone is already abducted, at this point, you change the relationship of the gluteus medius and gluteus minimus from an up and down relationship to an up and down and internal-external relationship. In other words, the more your iliac bone abducts, the more your gluteus medius gains the function of abducting the iliac bone. It doesn't store in the lower abdomen area. If your iliac bone is adducted, then at this point your gluteus medius is nearly vertical, so it has more of a front-to-back relationship. In this situation, when it outputs, it will pull the iliac bone and femur closer together, which is why it is said to maintain stability and support. So now, for most people's gluteus medius and minimus, during lateral support, they have acquired the function of counter-abduction. Originally, this function wasn't strong, but now that people have opened it up, it has become stronger. This is the relationship between them. When a person dies, they no longer breathe, so their pelvis returns to its original position, and their gluteus medius reverts to an up and down and front to back relationship. So this is what it does. You see, it is on the side, and its internal and external movements are relatively limited. So, when it performs this kind of movement, you see, it has a front to back relationship, and then it is diagonally forward. So during the process of fixing it below, slip of the tongue, what actions can it perform? It causes your ilium to internally rotate. It is more adept at ilium's internal rotation. When does the ilium internally rotate? It internally rotates when the ilium rotates backward. So the gluteus medius and minimus help you exhale, because when your ilium internally rotates, the backward rotation of the ilium represents exhalation. The gluteus maximus, especially the lower part of the gluteus maximus, is responsible for tilting your sacrum upward. What happens when the sacrum tilts upward? Right, it's inhalation. So under normal circumstances, the gluteus maximus is an inhalation muscle, and the gluteus medius and minimus are exhalation muscles. The patient cannot exhale, so you should not focus on training their gluteus maximus more. Instead, you can train their gluteus medius and minimus. Once trained, their pelvic floor muscles might be able to engage because their ilium might be able to internally rotate and adduct, and then the pelvic floor muscles will engage. So this is the relationship between them. Additionally, there are some internet famous coaches, and then after class, you casually open Xiaohongshu or Douyin and search for walking with the hips, and you'll find a lot of people with many followers teaching it. This is why I stopped updating my Douyin account, even though I have over 1 million followers. Because those who mislead others have a huge number of followers, and their followers grow quickly. So many people will hire them. When I try to talk about something serious, I get scolded, or they say I'm talking about metaphysics, or they just suppress it, or it gets limited in reach. I don't have the time, can't be bothered updating. I have an account with 1 million followers, left unupdated for years. You see, when you search, it's all like this. The key issue is that even doctors within the system, physical therapists, and PTs are teaching patients how to walk using their ilium and how to walk using their hips. Let me ask you, back in the day with those girls with peach-shaped hips, one would lie down and hold in front, squatting vertically down, and the other would do a hack squat with their buttocks. Which hip bears more force? The first one definitely bears more force, because the greater the angle of the torso, the more the hip is stretched, and the more force the hip bears. So what am I trying to express? What I want to express, what I want to tell you, is that which muscle your brain chooses to exert force depends on these 5 factors. The first is the strength of that muscle. The second is the speed of your contraction. The third is the angle of your joint. The larger the angle of your joint, the more the muscle is stretched, and the easier it is to activate the muscle. Then there's the type of contraction and the temperature of your muscle. These are the 5 factors. And here, what we coaches tend to focus on the most is this: the angle of the joint